name is Dr. Joshua Taylor. I'm a general surgeon. I'd like to thank you for coming to see me today in consultation. I'd like to use this time using this video to explain the reason you're here to see me and answer some questions so that when you and I sit down, we can have a more in-depth conversation about what it is that is exactly going on with you or any questions or concerns that you might have. A hernia is the medical word for a hole in one of our muscle layers. Most commonly, a hernia is located within the abdominal wall or the stomach muscle layers. The hole allows things from the inside to push towards the outside. And so you may notice a bulge, you may have some pain from where it's stretching that tissue, and in severe cases, things can get caught or trapped within that opening, and that usually results in more of an urgent or emergent reason to need surgery. If things are caught or trapped, it can also cause a blockage, so sometimes people can feel nauseated or sick to their stomach, especially when they eat. It can also create difficulties with bowel movements or create more issues with constipation. Hernias can be present for a variety of reasons. It may be that you were born with the hernia. You had what's called congenital defect in the muscle layers. Those are more common near the belly button and sometimes in the groin. The other reason that you can develop a hernia is if you've had prior surgery. When you were stitched back together, that may not have healed as well as it should have, and so that hole can develop from the prior surgery. So when you have a hernia, oftentimes you need surgery to repair the hernia. For whatever reason, our bodies do not fix hernias, and so surgery is the only way that we have found to repair a hernia. Oftentimes, I perform hernia surgery via minimally invasive surgery, so either laparoscopic or robotic. And that just means that there are less incisions and smaller incisions than doing it the traditional or old-fashioned way of creating a larger open incision to fix the hernia. When we fix hernias, we go into the muscle layer and we close the hole in the muscle layer. Any of those contents from inside that we're pushing out, we want to get back in their correct position before we close the hernia. One of the most common questions that I get asked is, will I be utilizing a mesh? And the answer in short is yes. In the majority of hernia surgery, we use mesh. The reason for that is that there have been very good studies that have shown when we just stitch the hole closed, we don't do anything to make the muscles any stronger. And so that hole can come back over time, and there's a very high chance that that will happen. And so a hernia mesh is used to strengthen the entire area. I like to use the concept of rebar being placed in concrete to make the entire thing stronger. And that's the function of mesh. If you watch TV, you oftentimes will see commercials about lawsuits associated with hernia mesh. And so the common issues that surround hernia mesh are, number one, there is a little bit of an increased risk of infection because oftentimes we use a permanent material. It's often made of plastic. And number two, you can have a complication from the mesh being you may have a reaction, it may not function the way that it should be. What I tell everyone is that likelihood is very, very low. The mesh material that we have begun to use is much more resistant to infection. And if you compare the risk of using mesh versus the risk of having a redo hernia surgery, those risks of the mesh are much lower than potentially needing surgery again. Number one, we have to create an incision to perform the surgery, and so you may develop issues with infection. Thankfully, there are not major blood vessels that are associated with the abdominal wall muscles, but you may still experience some bleeding. Unfortunately, we don't have a perfect hernia surgery, and so hernias can come back. And so you and I will talk about things that can help you to prevent a hernia from coming back. That can be allowing appropriate time to heal, avoiding certain exercises or return to work before it's time, as well as things such as keeping your diabetes or heart disease or lung disease and even weight loss under control, which can help prevent you from having hernias come back. I'll be in momentarily to talk with you and be more specific about what it is that's going on with you and how I think surgery might help. If you have any questions, feel free to write them down. You can re-watch this video and you and I will go through them when we